Within the blood, proteins called coagulation factors normally work together to help form blood clots to prevent excessive bleeding in an injury. People with hemophilia have a deficiency in one of the coagulation factor essential for blood clot formation. This deficiency prevents their blood from clotting efficiently, leading to excessive and prolonged bleeding after injuries or surgeries. They may also experience spontaneous bleeding in muscles, joints, and organs, which can be life-threatening. Conventional treatments involve frequent intravenous infusions of coagulation factors, which can be burdensome and affect vein health and quality of life. In October 2024, the U.S. Food and Drug Administration approved Marstacimab, marketed as Hemophilia, to prevent or reduce the frequency of bleeding episodes in adults and children ages 12 and older with Hemophilia A or Hemophilia B. To understand how Marstacimab works, let's first explore how blood clots form. When an injury occurs, platelets gather at the site, become activated, and release substances that promote clot formation. The coagulation cascade, a complex series of enzymatic reactions, is also activated. It involves the extrinsic, intrinsic, and common pathways. The extrinsic pathway is initiated by a tissue factor released from damaged tissues, while the intrinsic pathway is triggered by factors within the blood. Both pathways lead to the activation of factor 10, which is crucial for the common pathway. Here, factor 10 activates prothrombin into thrombin. Thrombin then cleaves fibrinogen into fibrin. Additionally, thrombin activates the stabilizing factor, or factor 13. Activated factor 13 binds with calcium to create fibrin crosslinks, forming a stable clot. Hemophilia A is caused by a deficiency in factor 8, while Hemophilia B is due to a deficiency in factor 9. These deficiencies impair blood clotting. Marstacimab is a human monoclonal antibody that is directed against tissue factor pathway inhibitor. Tissue factor pathway inhibitor, or TFPI, is a key regulator of the extrinsic pathway of coagulation. TFPI normally helps prevent blood clotting by inhibiting activated factor 10 and the tissue factor activated factor 7 complex, which are crucial for thrombin generation. This mechanism helps maintain a normal hemostatic balance. Marstacimab blocks TFPI. By blocking TFPI and increasing thrombin generation, Marstacimab promotes blood clotting through a mechanism that bypasses the need for factor 8 or factor 9, helping to prevent bleeds in people with hemophilia. Marstacimab's approval is based on data from a phase 3 clinical trial called BASIS. The study enrolled 116 patients with either severe hemophilia A or B. Before the intervention, participants underwent a 6-month observational period in which they received the usual replacement factors, intravenous regimen with factor 8 or factor 9 either prophylactically or on demand to manage bleeds. These patients then received Marstacimab for prophylaxis for 12 months. The study compared the annualized bleeding rate, which is the average number of bleeds requiring treatment per year, before and after receiving Marstacimab. Marstacimab significantly reduced annualized bleeding rates in patients with hemophilia. In those receiving on-demand factor replacement, the bleeding rate decreased from 38 to 3.2 after Marstacimab treatment. This was an impressive 92% reduction. For patients receiving prophylactic factor replacement, the annualized bleeding rate dropped from 7.85 to 5.08 during the 12 months of Marstacimab treatment, which is a 35% reduction. The positive effects of Marstacimab were observed across both hemophilia A and B, and in patients of various ages. The most common side effects of Marstacimab include injection site reactions, headache, and itching, or pruritus. The approval of Marstacimab provides patients with hemophilia with a new treatment option. It is the first anti-tissue factor pathway inhibitor approved, and the first hemophilia medicine approved for weekly administration via a pre-filled autoinjector pen. This offers a more convenient and less invasive treatment option than traditional intravenous infusion. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.